Prometric QA and rationals. 241 to 260. 241. The toddler is admitted with a cardiac anomaly. The nurse is aware that the infant with a ventricular septal defect will A. Tire easily. B. Grow normally. C. Need more calories. D. Be more susceptible to viral infections. 241. Answer A. The toddler with a ventricular septal defect will tire easily. He will not grow normally, but will not need more calories. He will be susceptible to bacterial infection, but he will be no more susceptible to viral infections than other children. Therefore, answers B, C, and D are incorrect. 242. The nurse is monitoring a client with a history of stillborn infants. The nurse is aware that a non-stress test can be ordered for this client to A. Determine lung maturity. B. Measure the fetal activity. C. Show the effect of contractions on fetal heart rate. D. Measure the well-being of the fetus. 242. Answer B. A non-stress test determines periodic movement of the fetus. It does not determine lung maturity, show contractions, or measure neurological well-being, making answers A, C, and D incorrect. 243. The nurse is evaluating the client who was admitted 8 hours ago for induction of labor. The following graph is noted on the monitor. Which action should be taken first by the nurse? A. Instruct the client to push. B. Perform a vaginal exam. C. Turn off the Pitocin infusion. D. Place the client in a semi-Fowler's position. 243. Answer C. The monitor indicates variable decelerations caused by cord compression. If Pitocin is infusing, the nurse should turn off the Pitocin. Instructing the client to push is incorrect because pushing could increase the decelerations and because the client is 8 cm dilated, making answer A incorrect. Performing a vaginal exam should be done after turning off the Pitocin, and placing the client in a semi-Fowler's position is not appropriate for this situation, therefore, answers B and D are incorrect. 244. The nurse notes the following on the ECG monitor. The nurse would evaluate the cardiac arrhythmia as A. Atrial flutter. B. A sinus rhythm. C. Ventricular tachycardia. D. Atrial fibrillation. 244. Answer C. The graph indicates ventricular tachycardia. The answers in A, B, and D are not noted on the ECG strip. 245. A client with clotting disorder has an order to continue Lovenox, enoxaparin injections after discharge. The nurse should teach the client that Lovenox injections should A. Be injected into the deltoid muscle. B. Be injected into the abdomen. C. Aspirate after the injection. D. Clear the air from the syringe before injections. 245. Answer B. Lovenox injections should be given in the abdomen, not in the deltoid muscle. The client should not aspirate after the injection or clear the air from the syringe before injection. Therefore, answers A, C, and D are incorrect. 246. The nurse has a pre-op order to administer Valium, diazepam, 10 mg and Phenergan, promethazine, 25 mg. The correct method of administering these medications is to A. Administer the medications together in one syringe. B. Administer the medication separately. C. Administer the Valium, wait 5 minutes, and then inject the Phenergan. D. You question the order because they cannot be given at the same time. 246. Answer B. Valium is not given in the same syringe with other medications, so answer A is incorrect. These medications can be given to the same client, so answer D is incorrect. In answer C, it is not necessary to wait to inject the second medication. Valium is an anti-anxiety medication, and Phenergan is used as an antiemetic. 247. Answer B. Voiding every 3 hours prevents stagnant urine from collecting in the bladder, where bacteria can grow. Douching is not recommended and obtaining a urinalysis monthly is not necessary, making answers A and C incorrect. The client should practice wiping from front to back after voiding and bowel movements, so answer D is incorrect. 247. A client with frequent urinary tract infections asks the nurse how she can prevent the reoccurrence. The nurse should teach the client to A. Douche after intercourse. B. Void every 3 hours. C. Obtain a urinalysis monthly. D. Wipe from back to front after voiding. 248. Which task should be assigned to the nursing assistant? A. Placing the client in seclusion. B. Emptying the Foley catheter of the pre-eclamptic client. C. Feeding the client with dementia. D. Ambulating the client with a fractured hip. 248. Answer C. Of these clients, the one who should be assigned to the care of the nursing assistant is the client with dementia. Only an RN or the physician can place the client in seclusion, so answer A is incorrect. The nurse should empty the Foley catheter of the pre-eclamptic client because the client is unstable, making answer B incorrect. A nurse or physical therapist should ambulate the client with a fractured hip, so answer D is incorrect. 249. The client has recently returned from having a thyroidectomy. The nurse should keep which of the following at the bedside? A. A tracheotomy set. B. A padded tongue blade. C. An endotracheal tube. D. An airway. 249. Answer A. The client who has recently had a thyroidectomy is at risk for tracheal edema. A padded tongue blade is used for seizures and not for the client with tracheal edema, so answer B is incorrect. If the client experiences tracheal edema, the endotracheal tube or airway will not correct the problem, so answers C and D are incorrect. 250. The physician has ordered a histoplasmosis test for the elderly client. The nurse is aware that histoplasmosis is transmitted to humans by A. Cats. B. Dogs. C. Turtles. D. Birds. 250. Answer D. Histoplasmosis is a fungus carried by birds. It is not transmitted to humans by cats, dogs, or turtles. Therefore, answers A, B, and C are incorrect. Questions with numbers. 251. Following a left anterior myocardial infarction, a client undergoes insertion of a pulmonary artery catheter. Which finding most strongly suggests left-sided heart failure? 1. A drop in central venous pressure. 2. An increase in the cardiac index. 3. A rise in pulmonary artery diastolic pressure. 4. A decline in mean pulmonary artery pressure. Answer. 3. A rise in pulmonary artery diastolic pressure suggests left-sided heart failure. Central venous pressure would rise in heart failure. The cardiac index would decline in heart failure. The mean pulmonary artery pressure would increase in heart failure. 252. A client with dilated cardiomyopathy, pulmonary edema, and severe dyspnea is placed on Dobutamine. Which assessment finding indicates that the drug is effective? 1. Increased activity tolerance. 2. Absence of arrhythmias. 3. Negative Homans sign. 4. Blood pressure of 160/90 mmHg. Answer. 1. Dobutamine should improve the client's symptoms and the client should experience an increased tolerance for activity. The absence of arrhythmias doesn't indicate effectiveness of Dobutamine. A negative Homans sign indicates absence of blood clots, which isn't a therapeutic effect of Dobutamine. 253. A nurse administers Warfarin, Coumadin, to a client with deep vein thrombophlebitis. Which laboratory value indicates that the client has a therapeutic level of Warfarin? 1. Partial thromboplastin time, PTT, 11/2 to 2 times the control. 2. Prothrombin time, PT, 11/2 to 2 times the control. 3. International normalized ratio, INR, of 3 to 4. 4. Hematocrit, HCT, of 32%. Answer: 2. Warfarin is at a therapeutic level when the PT is 11 to 2 times the control. Values greater than this increase the risk of bleeding and hemorrhage, lower values increase the risk of blood clot formation. Heparin, not warfarin, prolongs PTT. The INR may also be used to determine whether warfarin is at a therapeutic level. However, an INR of 2 to 3, not 3 to 4, is considered therapeutic. HCT doesn't provide information on the effectiveness of warfarin. However, a falling HCT in a client taking warfarin may be a sign of hemorrhage. 254. A client comes to the emergency department with a dissecting aortic aneurysm. The client is at greatest risk for 1. Septic shock. 2. Anaphylactic shock. 3. Cardiogenic shock. 4. Hypovolemic shock. Answer: 4. A dissecting aortic aneurysm is a precursor to aortic rupture, which leads to hemorrhage and hypovolemic shock. Septic shock occurs with overwhelming infection. Anaphylactic shock is an allergic response. Cardiogenic shock is the result of ineffective cardiac function. 255. During the insertion of a rigid scope for bronchoscopy, a client experiences a vasovagal response. The nurse should expect 1. The client's pupils to become dilated. 2. The client to experience bronchodilation. 3. A decrease in gastric secretions. 4. A drop in the client's heart rate. Answer: 4. During a bronchoscopy, a vasovagal response may be caused by stimulating the pharynx, which, in turn, may cause stimulation of the vagus nerve. The client may experience a sudden drop in the heart rate leading to syncope. Stimulation of the vagus nerve doesn't lead to mydriasis, pupillary dilation, or bronchodilation. Stimulation of the vagus nerve increases gastric secretions. 256. A client with right lower lobe pneumonia is ordered chest percussion and postural drainage. When performing percussion and postural drainage, the nurse should position the client 1. In semi-Fowler's position with the knees bent. 2. Right side lying with the foot of the bed elevated. 3. Prone or supine with the foot of the bed elevated higher than the head. 4. Bent at the waist, leaning slightly forward. Answer: 3. The aim of percussion and postural drainage is to mobilize pulmonary secretions so they can be effectively expectorated. In right lower lobe bronchopneumonia, the nurse should position the client with the right side upper lower lobes elevated above the upper lobes. This position would employ gravity in mobilizing pulmonary secretions. Semi-Fowler's position and being bent at the waist would hamper mobilization of secretions from the right lower lobe. 257. A client with acquired immunodeficiency syndrome, AIDS, develops pneumocystis pneumonia, PCP. Which nursing diagnosis has the highest priority for this client? 1. Impaired gas exchange. 2. Impaired oral mucous membrane. 3. Imbalanced nutrition, less than body requirements. 4. Activity intolerance. Answer: 1. Although all these nursing diagnoses are appropriate for the client with AIDS, impaired gas exchange is the priority nursing diagnosis for the client with PCP. Airway, breathing, and circulation take top priority for any client. 258. A client has chronic bronchitis. The nurse is teaching him breathing exercises. Which instruction should the nurse include in the teaching? 1. Make inhalation longer than exhalation. 2. Exhale through an open mouth. 3. Use diaphragmatic breathing. 4. Use chest breathing. Answer: 3. In chronic bronchitis, the diaphragm is flat and weak. Diaphragmatic breathing helps to strengthen the diaphragm and maximizes ventilation. Inhalation should be no longer than exhalation to prevent collapse of the bronchioles. The client with chronic bronchitis should exhale through pursed lips to prolong exhalation, keep the bronchioles from collapsing, and prevent air trapping. Diaphragmatic breathing, not chest breathing, increases lung expansion. 259, a client returns to the clinic 48 hours after receiving a MAN2 skin test. The area of induration at the injection site measures 18 millimeters. The client hasn't previously had a reaction to this test. The nurse's first action is to 1. Move the client to a negative pressure room. 2. Have the client put on a face mask. 3. Prepare the client to have a chest X-ray. 4. Draw a blood sample to check the client's complete blood count, CBC, for an elevated white blood cell count. Answer: 2. A client with an initial positive reaction to a MAN2 test is at higher risk for active tuberculosis. Before taking him to another room or for a procedure such as a chest X-ray, he should be fitted with a mask to decrease the risk of disease transmission to others. Drawing blood for a CBC isn't necessary at this time. 260. A client with acute respiratory distress syndrome, ARDS, is intubated and placed on mechanical ventilation. His partial pressure of arterial oxygen, PO2, is 60 millimeters of mercury on 100% fraction of inspired oxygen, FiO2. To increase his PO2 without raising the FiO2, the client will most likely be placed on 1. Time-cycled ventilation. 2. Volume-cycled ventilation. 3. Pressure support. 4. Positive and expiratory pressure, PEEP. Answer: 4. PEEP is widely used during mechanical ventilation of the client with ARDS. It improves gas exchange over the alveolar capillary membrane. Time or volume-cycled ventilation is less effective with ARDS than pressure-cycled ventilation. Pressure support is dependent on the client's inspiratory effort and not as effective as PEEP in the treatment of ARDS.